I am doing my third health education project on healthy sleep hygiene. SleepAssociation.org defines sleep hygiene as behaviors that one can do to help promote good sleep using behavioral interventions. After watching this video, you should be able to define sufficient amounts of sleep for different age groups. You should also be able to list potential consequences of insufficient sleep. And lastly, you should have familiarized yourself with healthy sleep hygiene. According to the Center for Disease Control and Prevention, or the CDC, the United States is experiencing a public health problem, even up to being described as an epidemic in relation to insufficient sleep. According to a recent study by the CDC, more than 1/3 of Americans are not getting sufficient sleep. On an annual basis, the United States loses about 1.23 million working days due to insufficient sleep. The United States experiences the greatest economic impact related to insufficient sleep and lost workdays than any other nation on earth. Sleep deprivation is linked to a higher mortality risk. People who sleep less than 6 hours per night on average have a 10% higher mortality risk. People who sleep 6 to 7 hours per night still have 4% higher mortality risk than those who get a sufficient amount of sleep, which is defined as about 7 to 9 hours per night. This amount can vary per individual and per the age of the individual. Young children, particularly school-aged children, can be affected the most by insufficient sleep. Young children who experience a lack of sleep or who experience a poor quality sleep can experience difficult behaviors, a lower capacity to learn, and a lower capacity to retain information. They may also be more likely to have poor eating patterns, and they may be more likely to experience weight gain. These children may be affected socially, as it may be difficult for them to make friends as a result of a lack of sleep. Our adolescent children or high school age children can also be greatly affected by lack of sleep. Adolescents need at least 8 to 10 hours of sleep per night because of the rapid growth of their bodies and their brains. But of all the age groups studied, adolescents have the highest proportion of insufficient sleep or poor quality sleep. A recent study notes that 60% of middle schoolers and 70% of high schoolers do not get adequate sleep on a school night. This number is even higher, upwards of 80% in certain states, including Michigan high schoolers. Some sleep study groups suggest high school students going to school an hour later than all other school-age children. Good sleep is essential for maintaining baseline mental health, as only one night of sleep deprivation can greatly affect your mood and productivity for the next day. Often recovery sleep is needed before we not only feel back to baseline, but function back to baseline. The chart attached shows some common sleep-wake disorders that some people may experience. If you suspect you may have one of these disorders, please discuss it with your physician. Daylight savings time has a profound effect on sleep. There are many calls from those who study sleep to eliminate daylight savings time. When we lose an hour of sleep by pushing our clocks forward, Many motor accidents are reported the next day, as well as cardiac events. Even when we push our clocks backward and get an extra hour of sleep, this often disrupts normal sleep routine and leads to insufficient sleep in the long run. The effects of poor sleep can lead to depression, anxiety, and other related psychological conditions. Feeling sleepy affects vigilance, reaction times, learning abilities, alertness, mood, hand-eye coordination, your accuracy of short-term memory, and it can also cause an increase in on-the-job accidents, motor vehicle accidents, and multimodal transportation tragedies. One of the most important things to eliminate in order to get sufficient sleep is blue light exposure, and namely television in the bedroom. This can also include being on your phone, a tablet, or a computer. Blue light emitted from television actually decreases melatonin secretion needed to fall asleep. Blue light also affects your cardiac rhythm. The screen affects sleep overall. It delays onset of REM sleep, and it also causes eye strain and headaches, particularly when watching TV in the dark. Healthy sleep hygiene habits include getting yourself on a normal sleep schedule and sticking to it. Pay attention to what you eat and drink. Don't stay in bed awake for more than 5 to 10 minutes. If you have been laying in bed awake, get up and go sit in a chair in the dark and allow your mind to race in that setting until you feel tired enough to attempt to go to bed again. As mentioned, do not watch TV or any screens prior to going to bed. Drink caffeinated beverages with caution, as caffeine effects can last for several hours after ingestion, and there are other foods such as tart cherries, kiwis, fatty fish, and malted milk that may be beneficial for sleep habits. Create a restful environment with clean, fresh air, possibly opening a window or investing in an air purifier. If you are watching your clock, hide the clock as you lay in bed. Have a good pre-bedtime routine, which may include a warm bath, a shower, meditation, or quiet time. Limit daytime naps. And lastly, include physical activity into your daily routine. Try to resolve your worries before you go to bed. Jot down what's on your mind and assure yourself that you will deal with it tomorrow. Additional information on healthy sleep hygiene can be found at www.sleephealth.org, www.sleepassociation.org, and at www.eachnight.com.